Bismillahirrahmanirrahim. Quote of the day. A good plan is like a roadmap. It shows the final destination and usually the best way to get there. Today, the topic of my presentation is planning model, proceed model, and patch match model. And I'm presenting it under supervision of my professor, Dr. Saira Afzal. Learning outlines. Learning outlines of my presentations are proceed model, strength and limitations of this model, steps of proceed model, patch model, phases of patch model, match model, steps of match model, and the last recent updates in MCQs. Learning objectives. In the end of presentation, participants would be able to describe different components of proceed model, patch model, and match model. Now, first, I would like to differentiate between theory and model. That what is theory? A theory is a tool to help health educators better understand what influences health, and it explains how or why life happens, and it developed over time. While a model is what it represents theory, it is a framework for investigation or design. Examples are patch or proceed model that we are going to discuss ahead. Now, first we'll discuss PRECEDE-PROCEED model. The originators of this model were Lawrence and Green Marshall and Crowther. Lawrence Green developed the first part of this model, that is PRECEDE, in 1974, and Crowther added PROCEED in 1991. This model is a framework of comprehensive health promotion or education program planning. The comprehensive structure is used for assessing health needs, for designing, implementing, and evaluating health promotion and other public health programs to meet those needs. PRECEDE provides a structure for planning a targeted and focused public health program, while PROCEED provides a structure for implementing and evaluating the public health program. Now, PRECEDE is an acronym that stands for predisposing, reinforcing, and enabling constructs in educational diagnosis and evaluation. It outlines a means for accurately diagnosing and planning a public health program for a targeted community, while PROCEED is an acronym for policy, regulatory, and organizational constructs in educational and environmental development. It facilitates the programs designed as a result of the PRECEDE process by guiding the implementation and evaluation of those PRECEDE programs. Now, this is the model for PRECEDE, and total there are 9 phases, out of which first 5 phases are of PRECEDE, while the second part, that including phase 6, 7, 8, and 9, these are the part of PROCEDE model. Now we are going to discuss each one by one. First phase is social assessment. It defines the quality of life of the target population. It involves members of population in a self-study of their needs. And the social indicators commonly used are abstinence, alienation, crime, discrimination, happiness, reward, self-esteem, welfare, unemployment. Then comes second phase, that is epidemiological assessment. It uses data to identify and rank health goals or problems that identified in phase 1, that is in social assessment. And the data it includes is disabilities, fertility, fitness, morbidity or mortality, physiological risk factors, that is incidence, prevalence. Then comes behavior environmental assessment. It determines and prioritizes behavioral environmental risk factors linked to epidemiological or phase 2 health problems. Behavioral factors include compliance, coping, prevention activities, and self-care, while environmental factors include economic, services, society, access, or affordability. Then comes phase 4, that is educational and ecological assessment. It identifies and classifies factors that have the potential to influence a behavior. These factors are predisposing, reinforcing, and enabling. Predisposing factors are what that they are any characteristics of a person or population that motivates behavior prior to or during the occurrence of that behavior. And those factors include any individual's knowledge, beliefs, values, and attitudes. And enabling factors are those are those characteristics of the environment that facilitates action and any skill required to attain specific behavior. And enabling factors include programs, services, availability, or any new skills required to enable behavior change. And the third, that are reinforcing factors, are usually the rewards or punishment following as a result of a behavior, and they serve to strengthen the motivation for a behavior. And examples of reinforcing factors are social support, peer support. Then comes phase 5, that is administrative and policy assessment. It determines if the resources are available to develop and implement the program. And this phase establishes goals and objectives. And this is the last phase of PRECEDE model. Here PRECEDE ends. Then comes phase 6, that is implementation phase, and it selects models and strategies of the intervention, and this is the phase from where PROCEED begins. Then comes phase 7, process evaluation. It is based on goals and objectives of phase 5, and it includes measurements gathered during implementation to control, assure, or improve program quality. And this phase is used to evaluate the process by which the program is being implemented, to determine whether program is being implemented according to the protocols, and it determines whether the objectives of the program are being met. And then comes phase 8, which includes impact evaluation. This is the immediate observable effects of a program, and it leads to the intended outcomes of a program. The impact evaluation measures the effectiveness of the program with regards to the intermediate objectives, as well as changes in the predisposing, enabling, and reinforcing factors. And this phase is also used to evaluate the performance of educators. Then comes phase 9, and the last phase, that is outcome evaluation, and it is the ultimate goal or product of a program, and it generally measured by morbidity or mortality, vital measures, symptoms, signs. Now, coming to the applications of this model, first is coalition building, then comes enhancing community participation, planning health education programs, planning multiple channel interventions, implementing health risk appraisals at work sites, planning employee assistance programs, influencing healthy worksite culture, and comprehensive school health culture, improving self-care and compliance behaviors. Then coming to the strengths of the PRECEDE-PROCEED model, it is the popular and most researched model. It is in existence for 4 decades. It is very comprehensive and covers all areas of planning. And in this days, initiation of the model utilizes community inputs and participation. Phased evaluation is a strong feature of this model. Then coming to the limitations of this model, it is too comprehensive to be applied in a reasonable time period at a setting. It requires heavy financial and human resource input to become functional. And it is a mixture of several theories, and one of the limitation is that it lacks comparative studies. Then this is the example showing the effect of PRECEDE-PROCEED model on preventive behaviors for type 2 diabetes mellitus in high-risk individuals. In first PRECEDE model, we start from the quality of life. That is, first we identify desirable outcomes, that is of behavior, environmental, epidemiological and social factors, and then we go backwards to identifying the predisposing, enabling and reinforcing factors, and then identifying administrative and financial policies needed, and then we move towards the evaluation phase, starting from the implementation, then process evaluation, impact evaluation and outcome evaluation, and here the proceed phase finishes. Now coming to our second model, that is patch model. It is an acronym that stands for Planned Approach to Community Health Model. It was developed in the mid 1980s by the CDC in partnership with state and local health departments and several community groups. Capacity building is a very important part of the patch model. It is designed to strengthen state and local health departments' capacities to plan, implement, and evaluate community-based health promotion activities targeted towards priority health problems. Key elements of this model are community members participate in the process, data guides the development of programs, participants develop a comprehensive health promotion strategy, evaluation emphasizes feedback and program improvement, community capacity for health promotion is increased. Now, these are the 5 phases of patch model. First, starting from mobilizing the community, then collecting and organizing data, then moving towards choosing priorities, then developing a comprehensive intervention plan, and the last, evaluating the patch model. Now, this is the CDC, or the other name for patch model is CDC model. First, the name given was CDC model. Now it is called patch model commonly. And this is the picture showing mobilizing vertical and horizontal communication support among the national, regional, and community levels. Here there is a horizontal communication among national level partners, and the examples of multiple sectors at national level are voluntary agencies, cooperative extension, National Education Association, and it also includes the horizontal communication at regional and community levels. Now, this is the example of patch model. In Baltimore, patch was implemented to improve the mental health among elderly people living in urban public housing developments. Health workers were trained to identify and refer residents who may need mental health care to a patch nurse. Psychiatric nurses with consultation and supervision from psychiatrists provided psychiatric evaluation and treatment in the resident's home. Investigators evaluated the patch program to determine whether it is more effective than usual care in decreasing levels of depression and other psychiatric symptoms. Then coming to our last model of the presentation, that is MATCH model. This acronym MATCH is an acronym that stands for Multi-Level Approach to Community Health. In this, intervention activities are aimed at a variety of objectives and individuals. And this is used when behavioral, environmental risk and protective factors are already known, and when general priorities for action have been determined, and it focuses on program development. Now, these are the phases of MATCH. First phase is goal selection, in which first we select health status goal, then we select high priority target populations, then we identify health behavior goals, and in the last we identify environmental factor goals. So these are the steps of our first phase, that is goal selection. Then we come to phase 2, that is intervention planning. First is identifying the targets of intervention, then we select intervention objectives, then we identify mediators of intervention objectives, and the last we select intervention approaches. Now, what are the targets of the intervention actions? The individuals that exert influence or control over the personal or environmental conditions related to the health and behavior goals. The levels of targets of intervention actions are individual, interpersonal, organizational, societal, and governmental levels. Then coming to the phase 3, that is program development. It also includes 4 steps. First is creating program units or components. Then we select or develop curricula and creates guides. Then we develop session plans. And the last, we create or acquire instructional materials, products, and resources. Then moving to the phase 4, that is implementation preparations. It includes two steps. First is facilitate adoption, implementation, and maintenance. And the last, select and train implementers. And the last phase is evaluation phase, that is conduct process evaluation, measure impact, and monitor outcomes. Now coming to the recent updates. Study the proceed this is the study in which a study this study was aimed to identify the effect of educational intervention based on proceed model on diabetes and blood pressure preventive behaviors in patients referred to selected comprehensive health centers. This model is known as a suitable method for preventing high risk behaviors in individuals. The present study is an attempt to determine the effect of educational intervention based on this model on diabetes and blood pressure preventive behaviors in patients referred to selected comprehensive health centers in Shiraz city. It was conducted as a clinical trial with intervention and control groups. And the result indicated that the mean scores of the participants after the intervention in all dimensions were significantly improved after the intervention, showing the effect of PRECEDE-PROCEED model. Then second article is here it is to which aim was to explore the effects of an educational counseling program based on the PRECEDE-PROCEED model during pregnancy on preventing postpartum depression. In this study, 130 pregnant women were selected and randomly assigned to intervention and control groups. Data collection was carried out using questionnaires of predisposing, reinforcing, and enabling factors in Edinburgh postnatal depression scale. Independent t-tests showed a significant difference between the two groups in terms of the mean score of predisposing, reinforcing, enabling factors in postpartum depression. The results supported the effectiveness of the educational intervention on reducing postpartum depression and showed that implementing these training during pregnancy leads to a reduced level of postpartum depression. Now, these are the references of my presentation. Now coming to the MCQs, first MCQ, which health planning model uses a framework to provide guidance in planning a health program and a framework for identifying strategies to address factors linked to outcomes of interest. Comprehensive health education model, patch model, match model, PRECEDE-PROCEED model. Any guess? The right answer is PRECEDE-PROCEED model, because in this model, there are strategies to identify the factors like epidemiological, behavioral, and social factors that are linked to outcomes of interest. Then coming to second MCQ, the educational and ecological assessment phase of PRECEDE-PROCEED include determining, predisposing, reinforcing, enabling factors, educational strategies, genetic environmental factors, and last is health and policy strategies.
A.
Yes, right answer is A, because in educational and ecological assessment phase, we have already discussed in detail about these three factors that are mainly focused. Now moving to the third MCQs, matching appropriate strategies and interventions with projected changes and outcomes occur during which phase of PRECEDE-PROCEED. Epidemiological assessment, administrative and policy assessment, implementation, and the last outcome evaluation.
D.
D is the right answer, that is outcome evaluation, because in this evaluation measures changes in overall objectives as well as changes in health and social benefits. MCQ number 4, refusing to wear a seat belt because friends will tease you is an example of a reinforcing factor, enabling factor, predisposing factor, strategic factor.
C.
No, right answer is a reinforcing factor, because the behavior of friends is strengthening the motivation for a behavior, that is the individual is refusing to wear a seatbelt because of his friend's behavior. MCQ number 5. Which of the following planning models supports intervention activities aimed at a variety of objectives and individuals? CDC model, proceed, proceed, match model, or mobilizing for action through planning and partnership model?
C.
Yes, right answer is C, that is match model, because it is mainly focused on intervention activities. MCQ number 6. Which of the following focuses on program delivered by public health professionals with responsibility for health communication? CDC model, proceed, proceed, match, or mobilizing for action through planning and partnership? CDC model or PASH model is mainly focused on programs that are delivered by public health professionals, as we have already discussed. So A is the right option. MCQ number 7. All of the following program models focuses on linking the communities, local health departments, and the state level health department, except PATCH, match, proceed, proceed, or CDC model. The right answer is C, that is proceed model. Rest of the models that are patch and CDC both are same, and the match model, they are focused on linking the communities and local health departments and state health departments. MCQ number 8. In proceed phase dash, which seeks to subjectively define the quality of life of those in priority population, is called dash. um, um, is it this is option A is epidemiological assessment, behavior environmental assessment, administrative and policy assessment, or phase 1 social assessment?
D. Social assessment.
Yes, right answer is social assessment, because in this quality of life of those which are in the priority population is defined. MCQ number 9. Which of the following planning models supports intervention activities aimed at a variety of objectives and individuals? CDC energy or patch model, then proceed model, multi-level approach to community health model, or match model?
B.
Yes, right answer is B, that is match model, because it supports intervention, target intervention activities. MCQ number 10. Which planning model was designed to be used when behavior, environmental risk, and protective factors are generally known? CDC model, proceed model, match model, mobilizing for action through planning and partnership model?
C.
Yes, C, match model, it is C is the right answer, because match model is used when the behavioral, environmental, social, protective factors are already known. This is the key of MCQs. Thank you.